There's a lot of money flowing into health right now. The big questions: are you investing in the past, the present, or the future? And will your investment pay off? For those who want to buy traditional, take a look at Grand Rapids, Michigan. Prominent local donors there have committed $1 billion. For that, they're getting a new medical school, which will house Michigan State programs, a children's hospital, a cancer treatment center, 2 medical office buildings, and a 7-level parking garage. $1 billion for bricks and mortar in the hope, in their words, of sustaining the economy and culture of a rebounding city of more than 193,000 residents. Now, for a different type of health bet, look at Royal Philips Electronics NV, or Philips for short, a household name whose consumer electronics business, overtaken by Asian clones, lost $2.2 billion in 2001. They paid $750 million last year for Massachusetts-based Lifeline, a service system and network to help seniors age in place. They plan to take it global. Like other big technology vendors with a history in health, think GE, Philips has been hospital-centric, selling X-ray and CAT scan equipment with some success. But CEO Gerard Kleisterly thinks times are changing. He says, quotes, "Patients are behaving more and more like consumers. They go on the internet and get second opinions. Care is being pushed out of the hospitals, which are expensive, and into the homes. It was all about technology. But times have changed. What is the hand of cards that I have, and how do I play them?" Close quotes. Kleisterly formed an internal work group to explore new value propositions and point Philips in a new direction. And what did they find? Health, but not the same old health. They started, said Senior Vice President Paul Smith of the Medical Systems Division, with an existing new complex product, and they redesigned it completely for lay people. What was the product? The Heart Start home defibrillator. At $1,200 without a prescription, homes and banks and hotels and shopping centers and airplanes have eaten the product alive. That triggered the Philips CEO in September of 2004 to launch a new consumer healthcare division. The simple command, quotes, "Look for opportunities outside the hospital." Mr. Kleisterly and peers such as Craig Barrett from Intel are now true believers. They've traveled the globe, they've attended medical meetings, visiting health thought leaders. They learned everything they could about aging and helped form and support the Center for Aging Services Technologies, or CAST, in Washington, which is an arm of the American Association of Home Services for the Aging. The sweet spots: self-reliance, connectivity, and prevention of functional decline. So how's it looking for 2007? Well, the Philips Consumer Health Unit is projecting sales of $1.5 billion. Talk inside of Philips is that its CEO has fundamentally changed the identity of what a lot of people at Philips stand for and believe in. He's done it, they say, by playing the cards he was dealt. And here they are. Number one, take the technology developed for professional use and redesign it for lay use. Number two, embrace the demographic megatrends of aging, consumerism, and the internet. Number three, move health from the hospital into the home. Number four, leverage connectivity, self-reliance, and prevention. That's why they bought Lifeline. So there you are. You have the Grand Rapids vision and the Philips vision for a healthcare future. Both are needed, but to what extent? Who takes the lead, and where is the center? One vision is bricks and mortar, the other service. One vision is professional-centric, the other consumer-centric. One is hospital-based, the other is home-based. One is driven by an historic health sector leaders, and the other by new health sector players. Where to put your money for the future? I'd invest in a vision that is led by those with financial assets, with IT expertise, and an existing position with products and services in the home, especially if they wisely build future planning around connecting the people to the people who are caring for the people. I'm Mike McGee.